Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment. We can see you've got some chondrosis, just some softening of the cartilage. Those are just kind of wear and tear changes, not really the acute reason that we're here, which is the tear in the meniscus. But while we're here, we can use our shaver to smooth out some of these areas, which is what we've been doing here. Here's the anterior horn of this medial meniscus over here. You can see that here. And that looks pretty good. It's the posterior horn that we're most concerned about. We'll show you that in just a minute. Pause recording. Okay, so here's the meniscal tear right here. And we're just using this small pair of scissors to help with our resection initially. We'll put the shaver in next. You can see some of the loose pieces that we can remove from the joint by using a little bit of suction also. So we're going to keep working on this meniscus, and then we'll look in the rest of the knee. Pause recording. Okay, so this is the central part of the knee. This is the notch where the anterior cruciate ligament lives. And we can see that here. We can see the posterior cruciate ligament is going to be back behind this tissue over here. We're not going to really expose it because there's no reason to. But we can certainly see some of the vascularity in the anterior cruciate ligament, although it does look intact here. Pause recording. Okay, so this is the lateral compartment. This meniscus is torn as well. And just like on the medial side, we're using our shaver just to smooth out some of the unstable edges here. You can see some of the chondral delamination on the femoral condyle up above also. Push down on the knee with your right hand. Okay, so I think that meniscus is resected back to stable margins there. Really about the best thing we have to try and firm up the cartilage and minimize your pain is a platelet-rich plasma injection. We'll talk about that in the office if you have symptoms that continue. I think doing a steroid shot would be a mistake in a knee that already has this amount of arthritis. But a lot of times we can use PRP injections, which you started to talk about a little bit, but a lot of times you can use PRP injections to give people substantial pain relief for a year or sometimes even longer, depending on how bad the arthritis is and how well they respond. So I think the meniscus there looks pretty stable. Don't really see much else to do there. Pause recording. Okay, you can come back around. Okay. Okay, so now we're looking up at the patella at the top of the screen here. At least in just a minute, we'll show you that. And as expected, there's some loss of cartilage on the patella too that goes along with having some arthritis in the rest of the knee. We can follow the trochlea here, and you can see you've lost cartilage in the trochlea. We can track this all the way down the front of the knee. And we can see it's right in this central area here where you've lost a fair amount of cartilage. Here's another area where the cartilage is a little bit unstable. Okay, so I think we're going to continue working just a little bit longer just to make sure there's no loose pieces of cartilage or anything, but the bulk of the video I think is done. Here we can see the extent of the injury to the patella. I shouldn't say injury, to the arthritis on the patella here. Okay, so we'll finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye. Stop recording.